Here are just some signs and symptoms of hypoxia and hypoxemia. So you can see I separate it into acute and late symptoms. In the next slide, you will see some signs and symptoms of hypoventilation and hyperventilation. And before we move on to the next slide, you can see down here it says central cyanosis. Remember, cyanosis, we talked way back, was the bluish discoloration of the skin, and that's because there is a lack of oxygen occurring. You can often look for signs and symptoms of cyanosis at the fingertips. They will turn bluish in color, the lips, and oftentimes in the darker skinned individuals, you may see in the sclera or the white part of the eye has a bluish tint to it. These are just some more signs and symptoms. This is of hyperventilation and hypoventilation. And with hyperventilation, you can see the individual to the right breathing into a paper bag, and this is to blow off the carbon dioxide so we can decrease that circulation of carbon dioxide. We don't want too much carbon dioxide circulating into our bloodstream. And you can see these signs and symptoms are listed below. Numbness is also included in hyperventilation. This next slide is actually me quite a few years ago on top of a mountain called Flat Top Mountain in Rocky Mountain National Park in Colorado. And as we talked before, hypoxia can be caused by high altitudes. And I actually experienced hypoxia while I was hiking with some friends. And it's also known as acute mountain sickness or high altitude sickness. And again, it's hypoxia. It's caused by a decrease in air pressure and low oxygen levels. And this flat top mountain is 12,000 feet in elevation. And I did experience, as we were hiking, shortness of breath, fatigue, and dizziness. And not just because I was tired, but because of the high altitudes. There was less oxygen and I was not accustomed to it. So this is just an example of how hypoxia can be caused. We are now moving on to structure and function of the circulatory system. The function of the circulatory system is to deliver oxygen, nutrients, and other substances to bodily tissues to support cellular life. The pumping action of the heart is essential to support the circulatory system. The four heart valves, tricuspid, pulmonic, mitral, and aortic, ensure the one-way flow of blood through the heart. And you can see all of the valves in the picture on the bottom right screen. Okay, and continuing on about the structure and function of the circulatory system, we're going to talk about multiple factors that deal with the regulation of blood flow. The heart muscle, or the myocardium, relaxes and contracts to support the regulation of blood flow. The contraction phase is called systole, in which blood is expelled from the ventricles into the systemic circulation. Afterload is the resistance of the ejection of blood from the left ventricle. The left ventricle pressure must be greater than the aortic pressure to eject blood from the heart. The relaxation phase is called diastole, in which blood fills the ventricles. Preload is the amount of blood in the ventricles at the end of ventricular diastole. Each contraction of the heart and relaxation of the heart consists of one cardiac cycle. So each contraction and relaxation consists of one cardiac cycle. Cardiac output is the amount of blood that is ejected from the left ventricle per minute. The normal range for an adult is 4 to 6 liters per minute. It is calculated as cardiac output equals stroke volume times heart rate. Stroke volume is the amount of blood ejected from the ventricle with each contraction. The normal range for an adult is 50 to 75 milliliters per contraction. The heart rate, or beats per minute, is regulated by the sympathetic and parasympathetic systems. Normal limits for heart rate are between 60 and 100 beats per minute for an adult. Myocardial contractility is the ability of the heart to squeeze blood from the ventricles and prepare for the next contraction. Myocardial index is the measure of adequacy of the cardiac output. Cardiac index equals cardiac output. Okay, be careful. So the ending of the last slide, I started to talk about cardiac index. And there is a formula in your book. You do not need to worry about that particular formula. Just know that cardiac index is the measure of adequacy of the cardiac output. And in your book on page 803, table 30-1, there is a whole chart there about the regulation of blood flow, and it goes through each of these definitions and what they mean. On this current slide is just a breakdown of each of the definitions that contribute to the regulation of blood flow. Down at the bottom you will find a link to a video on YouTube for cardiac output. If you are viewing this in PowerPoint, you can click on cardiac output. Otherwise, I will now play the video. You will only be able to hear the audio instead of view the video.
Today we're going to talk about a very important component of cardiac physiology, the cardiac output. And cardiac output is the amount of blood that the heart pumps to the rest of the body per unit of time. And it's dependent on two important variables. The first variable is the stroke volume. And the stroke volume is the amount of blood that is pumped per beat of the heart. The second variable is the heart rate. So the cardiac output is basically the stroke volume times the heart rate, which gives us a volume of blood pumped per unit of time to the rest of the body. Now, let's talk a little bit more in depth about the stroke volume. The stroke volume is dependent on a couple of key and important topics. The first topic, contractility. So you can imagine if the heart is contracting with more force, it's going to be able to pump more blood per beat, increasing the stroke volume, which will increase the cardiac output. The second key component of stroke volume is what is known as preload. And preload you can think of as the amount of blood that's sitting in the heart right before it contracts. Another way of thinking about preload is basically the end diastolic volume, or when the heart relaxes, how much blood flows into the ventricle to be pumped out. So preload increases, there's more blood ready to be pumped out to the rest of the body. Stroke volume will increase and cardiac output will increase. The third component is what's known as afterload. And afterload is the pressure the heart must overcome to eject that blood into the rest of the body. And this is basically the mean arterial pressure, which is a component of the blood pressure. So, these are the key and important elements of the cardiac output. And in future videos, we'll talk a little bit about why the cardiac output is such an important physiological topic to discuss when talking about different diseases of the heart and vasculature. Thank you.
Okay, now we're going to get into the conduction system of the heart, and this is responsible for our cardiac rhythm. The conduction system generates impulses, or electricity, that initiate the electrical chain of events of a normal heartbeat. Continuous electrical impulses are the beating of the heart. We have relaxation and contraction of the ventricles and atria. This is all because of electricity. The electricity originates from the SA node. Also, the SA is abbreviated for sinoatrial. So SA node is the sinoatrial node, which is also known as the pacemaker of the heart. This is located near the superior vena cava, which we will see in the next slide. And if you've ever heard of anybody getting a pacemaker placed, it's generally because they have a slower heart rate. And that's because, for lack of a better term, their electricity isn't quite up to par. So by placing a pacemaker, we're allowing that sinoatrial node to really send those impulses, those electrical impulses, to pump the heart. These electrical impulses are then transmitted along pathways to the AV node, which is the atrioventricular node, then to the bundle of His and the Purkinje network. And in the next slide, we will go through the electrical activity of the heart. In this slide, we will talk about the ECG, or electrocardiogram, also called the EKG. This records the electrical activity of the heart. So in the previous slide when we saw the video showing the electrical activity of the heart, here we can view the electrical activity of the heart on paper or through this complex, the P wave, the QRS, the T wave, and sometimes the U wave. The ECG does not record the muscular activity of the heart. Remember, it is solely the electrical activity of the heart. The normal sequence of electrical impulses on the ECG is called normal sinus rhythm. So the picture to the right shows normal sinus rhythm. The following slide will show a video of how to interpret an ECG, going more in depth into the P wave, the QRS, and the T wave. The P wave is what happens during atrial depolarization, or when the atria contracts. The QRS is during ventricular depolarization, when the ventricles contract, and the T wave is during ventricular repolarization, or when the ventricles relax. Please watch the video in the next slide for further explanation. Many illnesses, diseases, and conditions can lead to alterations of the circulatory system, resulting in an altered cardiac rate or heart rate, rhythm, strength of contraction, blood flow through the chambers, myocardial blood flow, and peripheral circulation. One disease that is often talked about is heart disease. So we are going to review quickly just controllable and uncontrollable risk factors that lead to heart disease. To the left of the screen, we have controllable factors, or risk factors that individuals can control or alter to decrease their risk for heart disease. The examples are as follows: smoking, uncontrolled hypertension, or the individuals with hypertension that do not control it with diet, exercise, or medications, physical inactivity, obesity, uncontrolled diabetes, uncontrolled stress and anger, and bad cholesterol levels. To the right are uncontrollable factors. So individuals may have these factors, and unfortunately there's nothing we can do about them, such as male gender, older age, family history, women who are postmenopausal, and ethnicity. So African Americans, American Indians, and Mexican Americans are more susceptible to heart disease than Caucasians, for example. We're now going to talk about alterations in cardiac functioning. So we can have some disturbances in the conduction or the electrical activity of the heart. Sometimes those electrical impulses do not originate in the SA node, and that can cause problems. We will get into a few of those, and an example would be a dysrhythmia. But also decreased cardiac output. And remember we said before that cardiac output is the amount of blood that is ejected from the left ventricle each minute. So if we have a decreased amount of blood that's being pumped down from the left ventricle, that can lead to many issues, specifically failure of the myocardium, which is the heart muscle and tissue, or the heart itself, to eject sufficient blood, enough volume. It can also lead or it can be a result of. So what can cause a decreased cardiac output? Some examples would be coronary artery disease, or CAD, valvular disorders. Remember we talked about those valves in the heart, the tricuspid valve, the bicuspid valve, the mitral valve. If there's any disorders or diseases of those valves, that can cause a decrease in cardiac output, as well as pulmonary diseases. We talked about failure of the heart to eject sufficient blood volume, so meaning pumping blood out to whether it be the pulmonary circulation or the system, the body as a whole. This can result in heart failure. So now where our heart is failing, it's not able to pump blood adequately to the body and the tissues. So again, this is what heart failure is. We have a decrease in cardiac output. Our heart is failing. It's not pumping enough blood out to our body and tissues. Then we get to the third bullet point with myocardial ischemia. Again, one of your key terms that you had to that was on your quiz, or you had to study for your quiz. This means there's not enough blood to the heart muscle, and insufficient blood supply to the heart muscle. We also talked about myocardial infarction, and this is when myocardial blood perfusion is blocked or severely decreased. So myocardial infarction, also known as a heart attack, is when myocardial blood perfusion is blocked or severely decreased. Some signs and symptoms of a myocardial infarction include chest pain, jaw pain, left arm pain, breathlessness, diaphoresis, and hypotension or low blood pressure.